This year's International Day of Midwife, commemorated under the theme Midwives, Frontline Health Workers, Humanitarian Heroes, serves as a timely reminder of the invaluable contributions of midwives in all contexts, especially in the most complex humanitarian settings. State Commissioner of Health Dr. Sani Mohammed Dambam, who acknowledged the critical role played by midwives in reducing maternal and neonatal mortality, said government decided to reintroduce community midwife program in order to provide skilled health workforce in communities. He commended UNFPA for supporting the state through its intervention in family planning services. Also speaking, the Executive Chairman, Bauchi State Primary Healthcare Board, Dr. Ruwan Mohammed, represented by Zuwaira Mahmood, acknowledged the role midwives play in recognizing and responding to complaints regarding pregnancy and delivery. Executive Director, United Nations Population Fund UNFPA, Dr. Nathaniel Kanem, said the organization is advocating for increase in financial and programmatic investment in midwifery to reduce maternal and child mortality in Bauchi State. She said midwives could avert 2/3 of maternal and newborn deaths while delivering vast economic and social benefits. Dr. Nathaniel Kanem, whose message was presented by the UNFPA State Program Officer, Deborah Tabara, explained that midwives can provide 90% of essential sexual, reproductive, maternal, and newborn health services, including family planning.
When bombs fall or floods wash away roads and homes, where services are severed and infrastructures has collapsed, midwives are often the first responders and the last line of defense. They often travel across even the most remote and dangerous terrain to ensure essential services that save lives and safeguard health and human rights.
She noted that as the world marks the International Day of the Midwife, she called on governments and donors to join UNFPA and partners in the Midwifery Accelerator Initiative, which aims to increase financial and programmatic investment in midwives and the systems that support them before lives are lost. She said that the need to work in synergy could not be overemphasized, adding that midwives save the lives of mothers and babies and also support survivors of gender-based violence, which skyrockets during crisis. The executive director urged all to work together to end the global shortage of nearly 1 million midwives and to ensure that we can end preventable maternal death once and for all. Dr. Nathaniel Kanem added that midwives often put themselves at enormous risk when they venture out to provide care to women and girls in hard-to-reach homes and communities in crisis settings. Yet, midwifery is still not always recognized as the vital health profession it is, noting, however, that chronic underinvestment in midwifery has translated to inadequate training, a lack of infrastructure and supplies, and low salaries, which are barriers that are present in times of stability and grow worse in times of crisis. There were presentation of reproductive, maternal, newborn, child health plus nutrition services, the role of the midwife by Dr. Robinson Yusuf, and another on sexual and gender-based violence by the UNFPA Gender and Reproductive Health Analyst, Deborah Tabara. To promise, Asama'u Abdullahi, Khadija Abba, and Yuseba Ubasani, who are all students of midwifery, they want more girls in the profession so that together they can help reduce maternal and infant mortality in the state.
We should send our children to school so that they will study midwife, because there is high rates of maternal and infant mortality and morbidity in the community.
And I want every community to understand that a midwife is a friend to all. So whenever a woman or anyone have a problem, the first one that should be in contact with is a midwife.
I feel like violence against women, female genital mutilation, post-marriage, early marriage, I want to help to reduce it in the community.
Participants at the workshop include students of Aliko Dangote College of Nursing Sciences Bauchi and their counterpart from the ATBU Teaching Hospital School of Midwifery, retired midwives, and provosts of the two institutions. The lecture gave the students the opportunity to ask questions on the profession and the papers presented. Elizabeth Ka, BATV News.